RVA Today is made possible by today's sponsor.
Welcome back to RVA Today. I'm your host, Naomi Brackett, and today's sponsor is Active Medicare Solutions. Well, we all know it's very important to take care of our health, especially as we grow older, and having the right insurance policy can be a huge part of that. Here to talk about some of the benefits and pitfalls of using Medicare as insurance is Active Medicare Solutions President Craig Rasmusson.
Good morning.
Good morning. Welcome back to the show.
It's nice to see you, Naomi. Thank you for having me back.
So you have a local company basically that helps seniors navigate this sometimes complicated process.
Yes, I do. Yeah, our company is called Active Medicare Solutions. We're a full-service Medicare-only insurance agency. We're located right here in Henrico. We have offices in Richmond and Colonial Heights, and we work with Medicare beneficiaries, explaining their options, helping them get enrolled, helping them avoid penalties, and then providing them service.
Fabulous. Yeah. While we're talking about kind of that process, I wanted to make sure to ask you about some of the common pitfalls that seniors experience when signing up for Medicare. Tell me a little bit about those errors.
Absolutely. Yeah, we see pitfalls every single week when we meet with clients. Usually it's centered around not consulting a local expert and trying to do it on their own. Oftentimes people come in and they're receiving a penalty because they didn't sign up properly or they didn't sign up on time.
Right.
And then we also see a lot of times folks that sign up when they don't have to, because not everybody that's turning 65 has to sign up for Medicare.
Okay. Yeah. So let's talk about some of those different options that people have. I tend to think of Medicare as kind of one umbrella, everyone's coverage looks exactly the same, but I don't think that's actually the case.
Yeah, it's not, and I know a lot of people are very confused, but actually when it comes down to Medicare, there's really two options, other than your work insurance, if you have that option even available. You're either with a Medicare Supplement, which is where Medicare is your primary insurance, and then you purchase a secondary insurance to pick up all or most of what Medicare doesn't cover.
Okay.
And then you also have what's called the Medicare Advantage plan, and that's where Medicare outsources your care to a private carrier. So you have one card, and it works like work insurance, and they also known as Part C, and those come with some extra bells and whistles at all. So it's really just, it's either you're a Medicare Supplement person or you're a Medicare Advantage person.
Okay, so not maybe as simple as people initially think, but what I love about your company is that you are that local face. So you're not stuck on a 1-800 number somewhere waiting to talk to a robot, but you can actually sit down and have a face-to-face conversation with someone.
Yes, that makes a huge difference. So contacting someone locally, there's a lot of people that, you can call Medicare and enroll, you can call the carriers, but you're really not getting the full story.
Right.
So when you meet with someone local, we have an office, you're able to find us, we take the time to go over your options, make sure you avoid penalties, and really hone in on which one of those plans makes the most sense for you, because everybody's different.
Exactly. Yeah. Well, if someone wants to get started with your company, or even is signing up for Medicare for the first time, when should they do that, and what should they be prepared to bring to a session with you guys?
Yeah, so when someone, they give us a call, I usually suggest getting started about 5 or 6 months ahead of time. I know we hear the 3 months before, but I think the important thing is coming up with a game plan, really determine whether or not you have to sign up, and then we can help educate you on how to sign up. And then it really comes down to bringing in a list of your doctors, a list of your medicines, so we can really do a good analysis and help you understand which plan makes the most sense for you.
Great. Well, thank you so much, Craig, for coming to tell us a little bit about these options for seniors. Make sure to call the number on the screen if you're interested in working with Active Medicare Solutions. And thank you for watching RVA Today. We'll see you next time.
Accurate.